Prenatal testing is, well, for couples, let me just use the terminology discordant couples in this context, because they are AS and AS. I would like to say that they are discordant, but not labeling them or trying to, downplay what they stand for by going through their belief and why they want to go through what they want to go through. Everybody is everybody. I respect people's decision. That's one thing about me. I respect people's decision, but I have to give you an informed consent, so that you can make an informed decision. So we don't try to castigate any person or any individual or any couple for what they stand to do. Let me just put this out there. So for couples that are both AS and they are looking into having children, well, yes, we are not saying they shouldn't marry. They can go ahead and do that, but they should know what they are getting into. The reason being that with each pregnancy that the couples have, the mother will have to be subjected to testing, either the CVS, that is the chorionic villus sampling, or we call it CVB, chorionic villus biopsy, or amniocentesis. This happens usually within the first trimester. Within either 10 to 12 weeks or 12 to 16 weeks, you have to do this test, and they have to probe into the belly, go through the membranes, and actually maybe aspirate the fluid around the baby. That's for amniocentesis. Or actually go to pick a tissue where the baby is growing or where the fetus is growing, so to speak. That's the one we call biopsy. Then this test will be subjected to DNA analysis. Either you use the common one we use the PCR, or you use what we refer to as the restrictive fragment length polymorphism, RFLP. Now, this will now tell you that, okay, this baby you are carrying, in this context now, is the genotype they will do now, not the phenotype, because they are looking at the genes that will code for the production of the hemoglobin S in this context. So you are doing a genotype here now, not a phenotype, because the baby is yet to form, baby is yet to develop, baby is yet to be born. So you are doing a genotype. So once they pick the fact that this baby definitely is going to have hemoglobin S, now it's not left to the couple to determine whether they will carry on with the pregnancy or to terminate the pregnancy. And of course, the advice will be terminate the pregnancy. Now, what if this couple have 10 consecutive pregnancies that are going to be hemoglobin S? Bearing in mind of the cost of this chorionic villus biopsy or amniocentesis is in terms of 300,000 to 400,000 naira, so to speak. At least last time I gathered that the test was being done is being done in a Sickle Cell Foundation in Lagos. So roughly between 300 and 400. So imagine you spending 300, 400 per pregnancy just to be sure that the baby you're carrying doesn't have hemoglobin S. Yes, the woman is the one subjecting herself to the testing. But at the other end as well too, the man is also going to feel it, because he's the one going to pay for this test as well too. You can imagine somebody just putting away 4 million naira just to be sure that, okay, at the 10 pregnancies that he's having, none of them is going to be hemoglobin S. Well, some can afford to do it, but I can't speak for most. I'm sure that our listeners as well are out there too. Can't speak for most people that will be able to go through this rigorous testing and also this money spending spree just to be sure that the baby is not hemoglobin A. Obedience is better than sacrifice. Like I said, I'm religious. It's in the book of Samuel. Obedience is better than sacrifice. If you prevent or you do not do it, you might not need to go through, all these stressful conditions or these stressful scenarios that might want to put yourself into if you don't put yourself into it. That's why we advocate that AS and AS should not marry. We're not saying that there's some states are even promulgating a law to prevent two AS couples from getting married, but we know it might not work Because I'm not sure whether policemen will just stop you and your wife when you are driving in town and say, okay, hey, come, we want to know whether you are AS or you are AS. And why are you guys married? You are under arrest because you are breaking the law. It might not necessarily work, so to speak. But at least we are trying to put the information out there so that people have informed consent and then make an informed decision. So that should you marry, these are the kind of scenarios that might play out. Are you psychologically ready for it? Are you financially ready for it? And as a couple as well too, are you ready to raise a child living with sickle cell anemia? Just know, even if it does not have symptoms early, the symptoms are bound to come through one way or the other. The hospital visits, the regular crisis, there's a lot of psychological and emotional stress and trauma that is associated with raising a sickle cell patient or a child with sickle cell anemia. I'm a living testimony and I'm giving my testament today. It is a lot of stress because at a point in time, the couple will come and say, this is like, this child is like, it is the demon himself. I have been spoken to like that before. Because the meager resources that my parents had to share among 5 children or among 4 children, so to speak, now has to be spent on me so that I can be well. At the point in time, my parents can just come and say, any time that I'm getting my salary, that's when you know that you'll be sick. You can imagine how a child gets to live with that kind of trauma, that word, that statement being spoken to him almost on an everyday basis. You understand? So that's why we advise him, don't do it. If you have the means and you are ready emotionally, psychologically, mentally, financially, fine. But still, even if you are ready, financial-wise, in every wise, still, there's a way it will still hamper on your emotions. I can bet you that on that it will still happen. So that's for the prenatal testing, so to speak. But there's another thing now. Medical science have even gone ahead of conception, so to speak, to determine whether the child that you are going to have, so to speak, is going to have sickle. We call it pre-implantation testing now. So this is even before the implantation process happens. But the couples will have to subject themselves to assisted reproductive techniques. I'm sure you know what ART, assisted reproductive techniques, mean. That is, for example, now some couples are trying to have a child and they can't have a child. They have to go and get eggs, they have to go and get the sperm and go and test it in the lab and make sure that fertilization occurs. Then they will now carry the eggs and then put it in the woman. So that is what we call assisted, in the simplest form anyways. That's what we call assisted reproductive techniques. So we do that in pre-implantation testing now. So that we will harvest eggs from the woman, harvest the sperm from the man, allow fertilization to occur in the test tube in the lab, you understand? And then the embryo that is developing, all of them will be tested using DNA analysis, PCR, to select the ones that are going to have sickle cell anemia. You selectively eliminate those ones. And then the ones that don't have sickle cell anemia will now be carried and be implanted into the woman. So that one can only occur only with ART, that is the assisted reproductive techniques. And you can imagine, you are doing DNA, you are doing all those harvesting, you are paying money for it, and you know what it costs to do assisted reproductive techniques as well, just to be sure that you don't have a child that has sickle cell anemia. It's a lot of ordeal. It's a whole lot of ordeal. So it's something we will not advise. But if, like I said, if you are ready for it, fine and good. But of course, just know that at a point in time, you will still need to write a book or tell a tale about what you went through, just to prevent the fact that you don't want to have a child with sickle cell anemia. And because you are marrying the love of your life, because the person is AS and things like that, you understand? So we like giving informed consent so that I can have an informed decision. So all those tests actually cost money. It can be done, yes. AS and AS can marry in that context, but you have to subject yourself to these tests and techniques just to be sure that you don't come down or you don't have a child that has sickle cell anemia. The amniocentesis might not be superior to the chorionic villus biopsy. So I think about between 12 to 16 weeks, while chorionic villus biopsy is 10 to 12 weeks, yes. So amniocentesis comes after. Amniocentesis is that the fluid that goes around the baby will still contain some cells. The baby is rapidly dividing, some cells are dying, some are forming up and things like that. So there will be a lot of cellular elements within the fluid around the baby. So it's you picking the fluid, centrifuging it, and then removing the sediments. So the sediments are the cells that you are looking for, and then you subject to DNA analysis. So it can tell you about the baby that is developing. That's what amniocentesis is about. Why the chorionic villus biopsy is just you doing a punch biopsy of the developing, we call it the membranes, the syncytial trophoblast and cytotrophoblast as well as, we call them membranes. The membranes developing around the baby, and then you biopsy it and subject it to DNA testing as well too. So the reason why is that you are biopsying a tissue, so there's every reason the patient, she might bleed, she might lose the pregnancy and things like that. So it's not at all comfortable. It is not comfortable at all. Understand? But one might not be superior to the other. The reason why you do it early is that once you pick the fact that maybe the child might have a sickle cell anemia or things like that, it's actually easier to, and the decide is still in the early stages than one that has formed, so that we don't have untoward complications as well too while trying to terminate the pregnancy and things like that. So it's one of the reasons why it has to be done earlier. And it's the chorionic villus biopsy, particularly the bleeding issue, might actually be something else. There's a risk that, okay, what if the baby is now not SS and the baby is EE, but you have done a biopsy, the woman hemorrhages, termination of pregnancy occurs. So who do you blame? Do you want to blame the procedure, person performing the procedure, or the whole thing? So it's just a whole lot of stress that you will not actually want a loved one to go through. So it is rather prevented than done. Now we are trying to raise mental health awareness, in Nigeria. So it also can be one of the avenues in which you get the psychologists, the clinical psychologists, and the psychiatrists also to come in, such that the woman is prepared psychologically for the test that she was about to undergo. So yes, you can actually do that, but to some extent as well too, there's a limit to which some of these things can be done, because you are talking about the mental stability of that individual. Because if you do that for the first time, you do that for the second time, you understand? There's every tendency that the stability tends to wane, with each procedure. It's very, very possible, because at the point in time, the woman can just tell you that, see, I'm tired. I'd rather just go through this like that. Be it SS, be it AA, I don't care anymore. I'll just have the baby. I have a friend that has actually gone through it. And at the end of the day, this was the testimony she gave me. And she only did one. She only went through one. The second one, she told me that she's not going again. That was just one. So you can imagine somebody doing 4, doing 5, so you can just imagine. Yes, to some extent, you can prepare someone. You can dare a soldier. You can prepare a soldier to go to battlefield. But when he sees his colleagues dropping, there's a level in which his mental stability will still be intact when he sees that, So there's a level at which you cannot guarantee that mentally wise, so to speak, the woman will be able to to conform. Let me just use the word conform, so to speak, because it's a whole lot of stress. I know women getting pregnant and having children is something that is precious to them, and you having to do the test and removing the babies. I'm sure no woman will want to go through that ordeal. I'm sure of it. No woman, even if they go through it once, I think once is a lifetime for them. So there's a level at which you can prepare them mentally. So that's just it. I think with each procedure, definitely you cannot guarantee that they will be mentally prepared, to go through subsequent ones. Okay, Nigeria was labeled, I think this was as far back as 2018, as the sickle cell capital of the world, in the sense that the carrier state of hemoglobin S is ranging between 20 to 25% of the population. Now you can imagine if 20 to 25%, and still rising, if about 25%, let's just say an average of 25% of 200 million people are walking around with hemoglobin S. That is, maybe they are AS now because they are carrier state. You can imagine what it means. That's like 1/4 of 200 million. That's like you have 50 million people going around that are HBAS. Now, in 2018, the Sickle Cell Foundation did its research and they found out that out of all the live births, that is newborn babies that are being given birth to in Nigeria, about 150 to 200,000 of them are sickle cell anemia. Yearly, 150,000 to 200,000 babies that are sickle cell anemia patients, or that have sickle cell anemia diagnosed. So you can imagine that number, that figure. That's like 10. That's like what is it? 1% of 200,000 now, going by the estimate. So that's because preference in Nigeria is about roughly 1 to 3%, averagely 2%, so to speak. So it's slightly more than that. But live births that are babies, out of the whole population of babies, there are 200,000 that are sickle cell anemia. So it's something to cause a worry about. It's something to cause a concern about. Now, Nigeria is not the only country in Africa, that has about 25% of carrier states. Now, in Congo, I think Congo Brazzaville now, they also have about 20 to 25% carrier rate. But the prevalence of sickle cell anemia in that society is less than 1%. Now you can see the difference. Now they have a well-robust structural program and awareness so that people that have this, that are carrier states, so to speak, do not get to have children, or they don't get to marry or have children, or sometimes, or be partners, so to speak. You understand? Not that in Nigeria that, you understand, some don't even look. In fact, you'll be shocked that in 2021, some people don't even check their genotype before even getting married. I was on a live radio show, I think last year, was it 2 years back, or I think it was 2 years back, and there was a caller that called him and told him that a woman was just betrothed to him. There's nothing about doing hemoglobin phenotype or everything. It was a family arrangement and things like that, and they kept having children, and you think about 4 of them out of 7 children, 4 of them were sickle cell anemia in a family of 7. That is a family of 9 now, including the parents, and then 4 have sickle cell anemia. So you can imagine, we are talking about 21st century, and these kind of things are still happening in Nigeria. So that's why we are labeled the sickle cell capital of the world, because we have the highest population of sickle cell anemia patients, in our country. I was born in the 80s, so to speak. I imagine as far back as then, we are still talking about sickle cell anemia. Now this is like almost 40 years on, and we are still talking about sickle cell anemia. You can see that it gives much to worry. There are a lot of things that need to be done. Apart from awareness, maybe we might need to formulate health policies, that can help us, take care of this. That's why I said some states are actually promulgating a law to prevent AS from marrying and things like that. In a bit, they are trying as well to, in their own capacity, to prevent or to reduce, so to speak, the incidence or the prevalence of sickle cell anemia in the community or in Nigeria. But we all have to do more. We all have to do more. We all have to partake in this and do more so that the burden is reduced. Hello viewers, I'm still Dr. Adeyemi Olusegun, Specialist Registrar, Department of Hematology and Blood Transfusion, Jos University Teaching Hospital. I'm a hematologist, transfusion medicine specialist, and also have a flair, for hemoglobinopathies and to some extent hemato-oncology, so to speak. Thank you for listening.